My name is Keith Gordon. I'm married to Donna Gordon, who you will hear from next. Donna and I went to a meeting this last Tuesday at the Cheer Center in town. Representative Mike Castle was in attendance. He was there ostensibly to gauge the public's feeling about health care in America. There were 7 representatives of various branches of our Sussex County health industry. They read prepared statements, and the overall impression given was one of a broken system which needs fixing. My impression was that they felt a form of government involvement in healthcare was desirable and overdue. The recurring theme seemed to be that we are the only industrial country that doesn't provide universal health care to all of its people. I don't know if this includes China and India. I'd be curious to know what the waiting list is for an MRI or an X-ray in these far-sighted, all-caring societies. But it's probably best not to ask, and for now, just go along with their premise. So let's say there is some truth in what they say. If America is so backward, why does Canada send its patients with serious and rare conditions to America for treatment? 80% of our nation has health care of some sort. Is it perfect? No. But what's perfection? At the meeting on Tuesday, there were 2 ladies in the audience who told different stories about their experiences with cancer. It's very hard to be objective when talking about someone's personal experiences without sounding heartless and cruel, but I'll try. The first lady had wonderful treatment for breast cancer and paid only $40 a year for medication which would have cost her thousands. The second lady had stage 4 lung cancer and was undergoing chemo. Her insurance company were refusing to pay for the treatment, and she was going to lose everything. This is horrible, but what kind of insurance policy does she have? She didn't say. Has she appealed to the State Insurance Commission? She didn't say. Because if she did, the law in Delaware mandates that the insurance company is liable for her legal bills, win or lose. This is one reason why most insurance companies will not insure in Delaware, which drives up the cost of insurance for everyone. My heart bleeds for people in this situation, but the first woman's story puts a little perspective on things. As she said, she was more than happy with her coverage and care. Then we found out why. She was a retired school teacher from Virginia. Apologies to retired school teachers. Her care was the result of her trade union being able to dictate the conditions of her policy. She no doubt has cradle-to-grave coverage and dental as well. I want that coverage. You know why I want that coverage? Because people like you and me in Virginia paid for her fabulous policy with our taxes. Anyone who knows me knows my opinion on trade unions, particularly the public service unions who are like the life-sucking entities on Star Trek. If government-controlled healthcare could give me the coverage that that retired school teacher has, I would be the first in line. But government-run healthcare does not elevate the masses to healthcare nirvana. It brings everyone down to one mediocre state, which after all is only fair. If you think the unions have too much power now, wait until you have a couple of million government unionized healthcare workers. But there is some good news. Under the plan currently being debated in the Senate, that First Lady has nothing to worry about. The 2 groups who won't have to join the public plan are Congress and trade union members. They'll be sucking at the public tit just like before. Meet the new boss, same as the old boss. What is government healthcare really like? Well, just last week, my 93-year-old mother was admitted to the Royal London Hospital for tests on her distended stomach. While waiting in her bed, some genius gave her a meal which she promptly ate. So the procedure was cancelled with the understanding that they would try to get her in the next day. My sister's husband, after a day's work, went to see Mum. They told him they hadn't been able to fit her in, so she was being sent home and rescheduled. In passing, he noted that the notice stating no food or drink was still posted on the wall above her head. No, they hadn't fed her for 33 hours. Oh, by the way, she's diabetic. The test is now rescheduled for 6 weeks from now. I went over a few weeks ago to see how she was being treated after a fall at home. My brother is going over on the 17th of this month. My dear sister is on the case constantly. As she said, it's easier getting facts out of the KGB than the National Health Service, and she pities any old person who doesn't have someone going to bat for them. The nations of continental Europe seem to have a better health system. You know why? Because they don't defend themselves. The good old US of A does that, and that leaves them able to live beyond their means and spend defence money on socialist good works.
Yeah. My phone rang, so the whole thing...
If this sounds good to you, I'm happy for you, because if this government has its way, that's your future. Having said that, if cap and trade gets implemented, the only care any of us will be able to afford is Pelosi care. Yesterday, those constant critics of America, China and India, stated categorically that they will accept no limits on their carbon emissions or industrial pollution. What's the bet that within a year or two, Obama's windmills will be made in China? Thank you very much.